Hello, this is Dr. Martin with your medical message. Today we're talking about a medical phenomenon that's been making headlines called scromiting. Yes, scromiting. You may say, what the heck is that? Scromiting is screaming and vomiting at the same time. Sounds really dramatic, but it's very real and is showing up more and more in emergency departments across the country. So let's break down what it is, what causes it, and how to recognize the signs before it becomes life-threatening. So scromiting is a slang term for a severe medical condition called Cannabis Hyperemesis Syndrome, or CHS. It's a cycle of uncontrollable vomiting, intense abdominal pain, and nausea that just won't stop. And in severe cases, patients are screaming from the pain. That's where the term scromiting comes from. So here's the surprising part. CHS, or Cannabis Hyperemesis Syndrome, happens in long-term, heavy cannabis users, even people who've been using it for years with no problems. So normally we've thought of cannabis as reducing nausea, but with chronic, high-potency use, the body can flip the script completely. So think of it like the nausea reflex gets rewired and stuck in overdrive. And one of the strangest symptoms is people with CHS often take multiple hot showers or baths every day to temporarily stop the symptoms. So if someone is vomiting uncontrollably, jumping into a super hot shower for relief, that's a major flag for CHS. So here are the signs physicians such as myself look for. Repeated, severe vomiting, abdominal pain that comes in waves, nausea that lasts hours to days, compulsive hot showers or baths, dehydration, heavy or daily cannabis use. Now remember, this isn't just a little bit of nausea. Patients often have visited the ER multiple times before getting the correct diagnosis. Scromiting can lead to severe complications as well. Severe dehydration, electrolyte imbalances, kidney injuries, esophageal tears from the vomiting, and repeated hospitalizations. And yes, it can become life-threatening if it's not treated. The only long-term cure for CHS is stopping cannabis use entirely. So when you come to the emergency department, physicians such as myself will treat your dehydration with IV fluids. We will correct your electrolyte imbalances, and we'll give you medication to stop the vomiting. But full relief only comes when cannabis is stopped. I repeat, full relief only comes when cannabis is stopped. So it doesn't affect everyone, but the risk goes up with daily use, high THC concentrates or edibles, and having used the cannabis for years without breaks. And no, this is not about judgment, it's about awareness, it's about safety. So if you or someone you know has repeated episodes of severe vomiting, relies on hot showers for relief, talk to a healthcare provider, because scromiting is real, it's painful, and it's increasing as the cannabis potency rises nationwide. So like, subscribe, comment. Let me know in the comments if you want a deeper dive video into CHS, cannabis potency. Stay safe, stay informed. I'll see you in the next video. This is Dr. Martin with your medical message. I'm out.